So there's some little freckles in your armpits there, aren't there? Okay, pop them down. And then if you could turn around for us. And I'm just going to lift your vest up at the back so that we can see your skin on your back, okay? Okay, so a few more little freckles there. Here, some smaller ones. Okay, and then I'm just going to check behind your very nice hair. Small one there. Okay, and while we're here, I'm just going to check the back of your neck as well. Behind your ears.
Leave station.
Okay, good. Do you mind turning around this way again? And do you mind if we look underneath your t-shirt at the front? Okay, so you put a few more there. And then one here. Okay, and then we won't take your vest off in this case, but let's just have a look at the top there. Okay, good. Now let's move on to having a look at your legs. Good. So one little freckle here.
Would you like to present your findings?
Okay, this is Sophie. She's a 14-year-old girl. She appears slim for her age, and I'd like to plot her height and weight on an appropriate chart. I've done a general inspection today. My positive findings are that Sophie has multiple pigmented skin lesions, which are consistent with cafe au lait patches. She has numerous cafe au lait patches, but she definitely has more than 6 patches, measuring more than 1.5 millimetres in diameter. She also has axillary freckling. These signs are consistent with a diagnosis of neurofibromatosis. I didn't see any evidence of neurofibromas today, though I would like to check with full exposure. I'd like to complete my examination by checking her blood pressure, checking her spine, and taking a family history of any first-degree relatives with the illness, as well as getting an ophthalmological assessment.
Can you tell me about the complications of this disease?
Okay, so neurofibromatosis causes a wide range of symptoms and complications. It's particularly important to look out for eye signs such as optic gliomas. It also causes short stature and macrocephaly, so it'd be really important to monitor growth. They can also get osseous lesions, so a full musculoskeletal examination would be helpful, and I believe these can sometimes be osteosarcomas, so close monitoring would be essential. They can also have renal involvement, so abdominal examination, monitoring of blood pressure and kidney function would also be important to prevent those. They can get scoliosis. As I mentioned, I'd like to examine Sophie's spine.
Anything else you'd like to include in your management plan?
So in terms of the management of neurofibromatosis, it's really important to take a multidisciplinary team approach, as well as the complex medical side of things requiring several professionals such as paediatrician, ophthalmologist, potentially orthopaedic surgeon or neurosurgeon. They often need educational support, so it's important to involve educational psychologists, potentially social workers, and sometimes a community paediatrician might be the best person to coordinate this.
Thank you.
Thanks.